Hari Om, Shri Gurubhyo Namaha, Om Dhanvantariye Namaha. I am Dr. S. Bharath Narendra from Bharath Clinic and Vibha Ayurvedic Center. We are going to talk about a very important topic today, diabetes. So, I get many type of patients who are diagnosed with diabetes only by accident. They usually go for some other problem like continuous urination, nocturia, that is a lot of urine at the night, or they want to keep on eating, craving for food, or they have too much of thirst. This is called as polyuria, polydipsia, and polyphagia. Otherwise, there are also other symptoms like diabetic neuropathy, diabetic nephropathy, over weight gain, some other skin disorders. In all these conditions, when we have a doubt, we always check for diabetes. In many conditions nowadays, there are people who have uncontrolled blood sugar levels. These blood sugar levels, even after giving oral hypoglycemic drugs, that is allopathic drugs, many times does not get solved. Many people live with sugar at 200, 300 mg per deciliter before food and after food. So there are many problems here. You have to look at the fasting insulin, PP insulin, that is before and after food, how much insulin is there, how much sugar is there, and all this. So basically, if you are being told that you are a diabetes patient, especially if you are a long-term diabetes patient, I'm going to give you a small diet regimen that you can follow regularly, and because of this, your sugar levels will definitely come down. So, I've been using this very successfully at my clinic. I've been doing this since some years now. So basically, Ayurveda actually allows us only to have 2 meals per day. Usually, this is also accepted by many modern physicians. That is, the bioinsulin peak. Automatically, there is a peak level of insulin that comes in our blood. With eating or without eating, it comes and goes off. That is, once in the morning, somewhere around 9 o'clock, it stays for 55 minutes, and once in the evening, somewhere around 8 o'clock, again, it stays for around 55 minutes, and then this bioinsulin peak comes down. So you're supposed to take your food 1 hour before this, and so that your insulin levels, when they are high, your sugar levels are also high, and both of them neutralizes each other, and the sugar is taken care of by the insulin. Most of us do not follow this. We eat a lot of times, once in the morning, once in the afternoon, and once in the evening. We have 3 meals. Other than this, we have tiffin in between, sometimes some other snacks, coffee, tea, fruits. So anything when taken other than these 2 times are always a problem. So, but you can question me. You are advised when you, especially you are a diabetic patient, you are advised to take food every 2 hours once and so on. Yes, you've been advised this because your blood sugar is not metabolized by the insulin, and hence you are supposed to keep on giving small amounts of sugar so that your insulin is able to metabolize this. But what we are supposed to achieve at last is, when you take meals twice a day, your body should be able to metabolize this properly and give the sugar to you in usable form, and it also has to use it properly. This is what we are aiming at. So what I suggest my patients is that a tiffin in the morning, or a very healthy breakfast like a kanji with milk and maybe with some fruits and vegetables in the morning. Number two, a normal lunch in the afternoon. Usually I allow 1 cup full of cooked rice along with a lot of vegetables. And thirdly, for the dinner, I ask them to take full fruits and vegetables only. I don't allow them to take 4 fruits. Number one, banana, which is green color, that is green plantain, or sapota, or pineapple, and jackfruit. These 4 things I ask people to avoid. Mangoes also. Other than this, I also ask them to avoid any fruit which is very sweet in nature and which is very ripe in nature. So better go for a fruit which is not completely ripe. Okay, and I ask the patients to chew the fruits and the vegetables properly and eat. And by meaning to say chew it properly, a minimum of 20 times per bolus. Once if you have a piece of fruit or vegetable in your mouth, you have to masticate it, you have to keep on biting it 20 times at least and then only swallow it. Okay, this helps a lot in bringing the sugar down. And these levels actually, this food actually brings the blood sugar level very easily down. But make sure you take at least 400 to 700 grams of fruits and vegetables put together. You can also add, if you're very hungry, you can also add a little bit of protein like chana or something in between along with this. But no rice, no other type of tiffin along with this. Only vegetables, maybe a little bit of dal and some protein if you feel like. So before trying this out, ask your doctor once and do this. Ask your Ayurvedic doctor once and do this. Definitely, it will be very helpful. A recent case where a patient wanted to go for an eye operation, his levels were 330 even after increasing his insulin levels, that is, injection, and his oral hypoglycemic drugs. His sugar did not come down below 250, and this diet helped them to bring it down to less than 150 in maybe a maximum of 2 weeks or so. And that is how we were able to do. That's only the recent case. We have been doing this very successfully. Try this. Ask for a Ayurvedic doctor's advice and try this. Until we meet next time, this is Dr. S. Bharath Narendra from Bharath Clinic and Vibha Ayurvedic Center. Thank you.